Tonight, as more and more states make marijuana legal, Major League Baseball will change its policy to keep up. The league has removed pot from its list of drugs of abuse and replaced it with opioids. The hope is to play a role in resolving the national opioid epidemic. Our Abigail James spoke to the Royals team doctor about what this means for our hometown team. This is big news, Abby.
Yeah, it sure is. You know what? We actually caught up here today with Royals team physician Vincent Key, who said with this new rollout, marijuana-related conduct will be treated the same way as alcohol-related conduct, which means there is still the potential for discipline. They just won't be testing Royals players for using it.
They got a pretty good variety here.
Some Royal fans say the new program is a great idea.
I think we need to keep the opioids on the list. I'm 100% for that. Marijuana, let them have the marijuana. They need to have a little fun every once in a while.
Others struggle with taking marijuana off the table.
Being a mental health professional, I can say that I believe that marijuana is a drug, that it is addictive, and that I've seen it ruin many people's lives. And if it were me making that decision, I would reverse that decision and keep it on the list.
Under the new program, players will be tested for opioids, fentanyl, cocaine, and synthetic THC, along with the other substances listed under drugs of abuse. Natural cannabinoids like THC, CBD, and marijuana will be removed from the list.
Definitely a good thing in terms of player safety.
The Royals team physician, Dr. Vincent Key, says the changes will hold players accountable.
It's a good thing in terms of being able to manage players, especially when we're talking about opioids.
You may remember 27-year-old Los Angeles Angels pitcher Tyler Skaggs, who died on July 1st. High levels of opioids were found in his system. The autopsy found his death to be an accidental overdose. Dr. Key says once an athlete is given opioids for a condition, they're on their own to be responsible for the drug. Therefore, education is essential.
I can only speak for the Royals that we do a really good job in terms of the way we manage players. In terms of education, and that's another big thing, is educating the athlete about marijuana, about opioids, knowing the right thing to do, teaching them, well, if they don't need the opioids, how do you dispose of them?
Well, players and team staff will have to attend mandatory educational programs in 2020 and 2021 on the dangers of opioids as well as practical approaches to marijuana. Reporting live, Abigail James, KCTV5 News.
Really interesting. Abigail, thank you.